Thank you for taking time to join me today. I promise to try to be brief and but provide you hopefully an update on some of the things that Hixny is doing to really create some new innovations for you, particularly as we think of ways to really help you use the systems that we provide to be more efficient and make your job a little bit easier. So of course, I think everybody knows, what it is we do. Clearly, our mission and our vision is to provide the right information in the right place at the right time. So obviously, getting that to be up to date and available when and where you need it. And the goal there is obviously to increase efficiency for you. But it's also about making sure that we have complete and accurate information. And we'll talk a little bit about that today, about some of the things we're doing to ensure that the data that we have is complete and accurate. And the goal there obviously is to improve the quality of care. And then of course, by getting it where you need it, when you need it in real time, it hopefully reduces the amount of time you spend searching for data from other providers, which is time hopefully that you can spend for patient care and use to really help enhance care coordination moving forward. So what I want to touch on today is really a couple of key technologies that we've developed or that we have versioned recently that we think really are doing just that are helping to really make your job a little bit easier. And the first one of those today is the patient record snapshot. It's an application that we developed released about a year ago. And that application is what's called the Smart on Fire application, which means that it runs both in our provider portal as well as directly through Epic and Cerner EHRs. It means that you don't, for the providers who have one of those EHRs, it means they don't have to leave their workflow in order to access the application. We are trying to work with other vendors. We've heard from a number of providers in the community that'd love to have access to that application in their EHR. But currently, we're waiting on some of the other vendors to develop the capabilities or make those capabilities available to us. But as soon as those are available, we will seek to make them available to more and more EHRs moving forward. But what we wanted to briefly talk about today is the fact that we've released a couple of weeks ago a new version of the application, version 2, with the goal of really trying to improve the workflow and essentially just remove the number of clicks it takes to get to the information that people are trying to get to. So essentially, how do we make it faster, better, and cheaper and make your job a little bit easier? One of the things that we've done is we've added new patient information up here at the top. You can then see a full patient profile, which gives you information such as next of kin, patient aliases, as well as contact information. We're getting a high percentage of cell phone numbers and other information into our system these days. And a lot of folks, when they're trying to coordinate care, find some of that information tremendously valuable. In addition, we've also added some capabilities to allow you to see more data. In the first version, some of the categories did not allow you to then see details about that data, but we've added that to all of the categories. So by clicking See All here, you can see any of the procedures or lab results or radiology and so on and so forth. And obviously, we've kept the quality indicators up here at the top so that very quickly and easily you can see if we've identified a specific gap in care, or equally important, if a specific gap in care has been completed, such as a patient getting a qualifying breast exam or colonoscopy. In addition, we've added some new export capabilities. We've heard that in the past that some of the printing functions that we've had really meant that providers would take and print something onto paper, scan it and into a PDF, and then upload it into their EHR. So we've given you new export capabilities, which will just export it directly to PDF, cutting out that whole scanning step moving forward. And one of the most exciting things that I think we've added is the capability of here in the corner. I don't know if you can see my mouse, but what that does is by clicking on that button, you can show or hide your own data. So for providers who contribute data to Hixny, being able to see your own data, which you can already see in your EHR, is probably something that just adds noise to your system. But so you can click to hide that data and just see the data from other providers in the community that were not contributed by your organization. But for those users who need to see your own data for some reason all in one place, or if you're an organization that does not contribute data and you want to see everything, you can choose to show it. And just by simply toggling back and forth, you have the opportunity to do that really simply. So the patient record snapshot is really a focus on trying to make things much more efficient. And in fact, what we're really focused on here, and I talked about that see all capability, is not just the ability in that dashboard view to get what you need, but we recognize that a lot of times you're going to need more detail. And so providing faster access to that, we believe is critically important. So you can see here, this view shows you what it looks like when you click on the see all capabilities. And previously, what you had to do is open a document, look at it, and close it. So if you're searching, trying to find the right document, that meant a lot of clicks and a lot of opens and closes. But now with just by opening this, you can just highlight the individual document, and you can see it here on the right. And then you can see you have the export capability right there available to you at any point in time. So very quickly and easily, you can view lab results or documents of different types of radiology reports very quickly and easily in one simple click. And then in that same view, you may have noticed that there was now next to each column heading an ellipsis, or these 3 dots. When you click on those 3 dots next to any column, you can sort it just like you would in Excel, or filter it based on what facility you're looking for. So if a patient has, for example, said, I went to Ellis Hospital recently and I had a CT scan, you could click on Ellis and filter the data quickly just down to Ellis and see what you're looking for. At the same time, you can also use the new search capabilities here to type in part of a keyword or a whole keyword and filter the list directly to that keyword. So if you're trying to coordinate care and identify whether a patient has had certain types of preventive tests or services, for example, it's really simple to just type in that keyword and then have that list filtered to that. These will work in conjunction with each other. So if, for example, you're looking for something that's pretty common and you only want it at one facility, you could filter that facility and then use the search capability to identify it. And then by clicking on it, you would see it right over here like I showed you a minute ago. So all of this is really intended to make it really simple and easy to view the data and really mirror applications that you're already using, such as Excel. And what I'd really want to talk about for a second here is what is coming soon with the application. So currently, as I mentioned, the version 2 is available really through our provider portal. We're working to also get that updated in the Cerner and Epic applications. There's extra steps for us to do that because Cerner and Epic have to approve all of the changes, and it requires regression testing in order to do that. And so we will be looking to get that done shortly as well. But in the interim, one of the things we're working on, which will become live later this year, is to improve the login process. So as we've increased our cybersecurity capabilities, we've added 2-factor authentication, which, as most of you know, requires you to enter a code that is emailed to you in order to log on to your system. And then that will place a cookie on your system moving forward. If your organization wipes out the cookies every day, you're required to do that every single day, or every single time you use the system, which can be a little bit challenging, especially if access to email is a little bit difficult. So we'll be taking a number of steps here to make that a lot easier. First, we'll be adding new types of ways to get access to that verification method, not only using other types of systems such as text and other things, but eventually being able to just approve your own access through an application that we'll provide at some point in the future, later this year. The other thing that we wanted to make sure everybody knew about is that we've recently received a grant to make the system capable of viewing and making social referrals directly from the tool itself. So obviously over the past few years with disrupt and just a focus in healthcare in general on being able to integrate social care and social determinants of health with healthcare. Hixny will be focused on being able to allow providers to do that directly in the patient record snapshot itself. So providers will be able to search social referral directories and identify patients who are social providers, for example, who provide housing assistance or food assistance or transportation or other social services that meet the needs of the social determinants of health, and then be able to make a referral from the system directly to that organization moving forward. And so our grant has a deadline of March 31st of 2022. So we expect that the capability will be available early in the second quarter of 2022. So it's likely that some folks will get the opportunity to beta test it in Q1 of 2022, but the general release will occur probably in that following quarter. So we're super excited about that capability. It's something that we've heard a lot of providers have told us is really necessary, and we're partnering with a number of organizations in the community who already are part of this. So we're not trying to reinvent the wheel when we create these capabilities, but really enhance the capabilities that already exist in the community to support that. Next, I just wanted to talk to you briefly about something we've been working on for the last year. Last year, we were the first in the nation to be accredited by NCQA as a data aggregator. And most people would associate that with health plans, because obviously what that data aggregator does is it gives you the health plan the ability to use the data as a supplemental data source for HEDIS audits and for charge cases. But it's equally important for providers in our community, because in order to get that accreditation, Hixny is required to do a primary source validation of the data in the EHR with the data that's in our system. So what that essentially does is it really validates from a third party that there is a mirror image, essentially, of the data that exists in the EHR and in our system. So if you're using it to coordinate care, to do a variety of patient-related activities, you can be confident that the data that we have is accurate and complete from that perspective. It also means that as a provider in our community, that the health plan hopefully will spend less time asking you for charts, and that will translate to less disruptions in your offices, and hopefully then therefore also mean that you can then spend that time with your patients and doing things, different things than supporting the health plans moving forward. We're currently going through that process for reaccreditation right now, and we expect that we will get that accreditation over the next few months and be the first in the nation to actually be reaccredited by NCQA. Also briefly want to touch on our provider portal reporting capabilities. Really the goal here is, of course, to really improve quality of care. So if you use our provider portal, we have capabilities in there that allow you to search for and view gap lists or compliant lists for your patient populations. So in the patient record snapshot, where you can see the information for an individual patient, so has this patient had a qualifying colonoscopy in the appropriate period. This tool gives you the ability to see the whole list of patients who have gap, or to see all of the patients who in fact have had that gap closed, and with a link to the information that is available to support that. And the goal here is to help improve care coordination, and we have a variety of other pieces of information available in that. We have what we call our at-risk list, so you can see certain conditions, patients who may be transitioning from certain parts of patients with certain chronic conditions who may be transitioning to a more severe version of that. So a patient, for example, transitioning from prediabetes to diabetes. And so who's at risk for future complications and other things, a hypertensive patient who is currently uncontrolled. And then, we give you a variety of information to help specifically with quality of care measures by identifying patients who might be withdrawn from a denominator. So patients with certain comorbid conditions, and we provide some overall quality measurements and a variety of other things such as COVID-19 vaccinations and other information. But it's just one of the ways in which we're trying to provide information both at an individual patient level through the patient, the record snapshot, as well as through the aggregate population level through provider portal reporting. The next thing that I wanted to touch on here this morning is to talk a little bit about our patient-directed notifications. So many of you may be aware that CMS last year instituted requirements for hospitals that they had to notify providers upon patient admission and discharge as a condition of participation in Medicare. And so Hixny, as part of this effort, has been working with all the hospitals in our community to enable the delivery of those notifications. And we've done that in a variety of ways. And one of those we think is very innovative. Providers can subscribe to notifications, but in some instances, if you haven't subscribed to the notification and you want to know about your patient, there's a variety of ways that we can do that. One of the ways that we've done that is by allowing the hospital to actually verify the patient's identity and then to collect the patient's email address or cell phone number. And then upon registration or discharge, the patient is sent a link through whichever method they prefer to receive that from, and they can select which providers they would like to have notified about their recent visit. So it gives the patient the control to determine which providers in the community they think need to be alerted about their care, and hopefully to improve care coordination. So many times we don't know about who a patient's PCP is at registration. We don't know some of the information that we might otherwise need to know. So by giving the patient the opportunity to do this, they're able to direct them wherever they want them to go. And when they select those, the information then flows directly to the provider and will flow directly into their EHR, either through direct or through the existing alert or notification channels that Hixny has established with that EHR for that practice. So it's a way for providers to stay connected. It's a way for patients to communicate and feel like they have control over where their records are shared. And it's a great opportunity for providers to know in real time what's happening with their patients when there is a transition in care, either into or out of the emergency room or inpatient setting. Lastly, what I wanted to really just hit on today is that if you've seen some of this information today and you think you have some ideas about things that Hixny can do to help make your jobs easier in the future, or you have questions or would like to access resources to better equip yourself or your teams with information to use our tools effectively, there's multiple ways that you can do that. One is you can go to our website at hixny.org and choose the login menu option, and under there is a link to Hixny Academy. Most, if not all, of our users will have access to that Hixny Academy, and there's a variety of resources available in there: training videos, documents, helpful hints, and a variety of other things that can help people learn how to use our tools effectively and efficiently. We also have added new functionality directly to our website to enable people to chat directly with us during normal business hours. And so at the bottom of each page on our website, you'll see a Contact Us tab. And by just clicking on that and entering some information, you can chat directly with us if you have the need to get access to support for any reason, or you have some basic questions about our systems. And of course, all of our users and organizations have an account manager who I'm sure you all know quite well. But if you call our main number or call them directly, they're certainly more than willing to assist you with any type of issue that you have, or point you in a certain direction should you have any questions or need for of any of our services moving forward. And then finally, what I wanted to just touch on today is that many of you on the phone here today or online today may receive a survey for the last 3 or 4 years. The Shiny has conducted an annual satisfaction survey that is meant to gauge the satisfaction of the users, not only in Hixny, but across the state with their satisfaction of the Shiny. And you may receive a survey from an organization called NORC. It would come as an email at shiny@norc.org. NORC is the University of Chicago organization that does survey information that was hired by the state to do this. And their focus is really on being able to gather some information. So if these tools that I shared today, or just the tools in general that we're providing or services we're offering, are really helping you improve your quality of care or improve productivity, or helping you become more efficient or making your job easier, and you agree that that's true, then we'd really love for you to tell those organizations, tell NORC that if you get the survey. It's a sample, so not every organization will get the survey. But if you whitelist shiny@norc.org and they try to email you, it'll be sure to get through to you. It's really important to us to perform well on that survey. From the state's perspective, they look and compare each of the QEs in the different regions around the state and how we're performing. And they really value the opinion and the information that you can provide. And if you do get the survey, there are opportunities for some people who are surveyed to actually share that survey with up to 5 additional people in your organization. So if you are asked to share that with what they refer to as knowledgeable respondents, we strongly encourage you to do that, because the number of responses that Hixny gets on the survey are important in order to establish a large enough sample size to create a reasonable result for them. And so if you're not sure if who in your organization to forward it to, you certainly can reach out to anybody at Hixny, your account manager, or others about who are the most common users in your organization, and we'll be happy to provide that information to you. And we strongly encourage you to do that, because I think it would be very helpful for us to know how you're thinking, and specifically to know if the things that we're doing and that I shared here today are really making your job easier. So those are the things that I wanted to touch on this morning. I think I started the presentation here by saying I'd like to be short and sweet, and what I'll do now is open it up to any questions that anybody has. Katie, we may have to unmute people, or.
Hey, Mark, it doesn't look like there are any questions in the chat, but like he said, if anyone does have any questions, please feel free to unmute yourselves.
Okay. All right. Well, if you don't have any immediate questions, but you have a chance to think about some of these things and a question pops up later, please don't hesitate to email me or email somebody, or use one of those methods I talked about, such as the chat function, to ask any of your questions. We're here to assist you. And we hope that some of these new features and services that we're providing really will make a difference for the things that you're trying to do in your organizations. And we appreciate your time today.